Assalamualaikum and salam sejahtera. I'm Hafiz. Today we will discuss about a review paper on exercise and chronic heart failure. As for introduction, heart failure is a complex clinical syndrome that can occur due to various structural or functional cardiac disorder, leading to impaired ventricular function in terms of blood filling or ejection. In US, there are about 6.2 million newly diagnosed cases of heart failure reported between 2013 to 2016, and in 2018 there were about 4,000 Americans waiting for heart transplant, which 55 of them await both heart and lung transplant. In Malaysia, it accounts for 6 to 10% of total acute medical admissions, around 1.8% of total healthcare expenses. The Indian ethnicity specifically has higher prevalence of cardiovascular disease. Heart failure classification by New York Heart Association, Class 1 and Class 2 mild. Class 1, no limit on physical activity, but Class 2, there is a minor limitation on physical activity. Class 3, moderate, marked limitation on physical activity, but comfortable at rest, but less than ordinary physical activity result in restlessness, palpitation, chest pain, and fatigue. And last one, Class 4 is severe, patient unable to carry out any physical activity deprived of discomfort. Based on American College of Sport Medicine (ACSM 2018), there is a guess to perform aerobic, resistance, and flexible exercise based on FIIT. For the frequency, aerobic exercise should perform 3 to 5 days per week with intensity of 60 to 80% of heart rate reserve if there is available gradual exercise testing. If not, use RPE scale of 11 to 14. Time progressively increase to 30 minutes per day and then up to 60 minutes. For type, they can use treadmill or free walking or stationary bike. For resistance exercise, you perform 1 to 2 non-consecutive days per week. Begin with 40% of 1 RM of upper body and 50% of lower body. For time, 2 sets of 10 to 15 repetition. Focus on major muscle groups. Type, they can use machine weight. And then for flexibility, you perform 2 to 3 days per week. And daily should be the best. Intensity, stretch to the point of feeling tightness or slight discomfort. Perform 10 to 30-second hold for static stretching with 2 to 4 repetitions for each exercise, and they can use whether static, dynamic, or PNF stretching. Then, according to the Shuvalova et al. 2020, they said combination of aerobic and resistance exercise could benefit the heart failure patient. So for the aerobic exercise, people with heart failure patient should perform 3 days per week for 12 weeks with the intensity of 50% to 70% of heart rate reserve, time for 30 minutes to 1 hour, and just walking time. For the resistance exercise, patient can perform 2 or 3 times per week but not on 2 consecutive days. Perform 2 sets of 12 to 15 repetition with RPE rating perceived physician less than 15, which is moderate, with timing around 1 to 1 hour 30 minutes, and they can perform lower and upper body resistance using color-coded TheraBands or TheraQuads. And then according to Dunn, Smith, Liu, and Olsen 2019, heart failure patient also can perform high intensity interval training. So based on the study, patient can perform 12 weeks of HIIT, which is 4 bouts of 4 minutes at 90 to 90% of peak heart rate, and then interspersed with 3 minutes active recovery or rest with 60 to 70% of peak heart rate. They can perform 3 times per week with the mode of bicycle. Then how mechanism of exercise improve heart failure? So if heart failure patient doing exercise, basically they will generate of reactive oxygen species ROS. So this ROS will stimulate the mitochondrial activities, antioxidant capacity, and oxygen expression, which further benefit overall cardiovascular health. Besides that, aerobic exercise also will produce a reduction of inflammatory markers such as C-reactive protein, interleukin-1, and also TNF-alpha. This will further enhancements of interleukin-6 in skeletal muscles and further influence fat metabolism, reduction of visceral fat, and this overall will results in body's redox balance and improve cardiovascular health. Then, last but not least, exercise also will promote development of new blood vessel. Thus, will increase the arterial lumen. Then, will showcasing the remarkable adaptability of the vascular system and further will improve the heart failure patients. Now, we are going for limitation and exercise-related risks for chronic heart failure patients. Of course, we need to know exercise contraindication for heart failure patient. No exercise if the patient experience of myocardial infarction within the past 4 months. Then moderate to severe aortic stenosis, unstable angina, uncontrolled hypertension, and uncontrolled ventricular or atrial dysrhythmias. Every exercise professional should be vigilant and discontinue exercise immediately if the patient presents with diastolic blood pressure above 110 milliliter mercury and a decline in systolic blood pressure exceeding 10 milliliter mercury. Second or third degree heart AV block, significant ventricular or atrial dysrhythmias, exercise intolerance, dyspnea, chest pain, or abnormal sign of ECG such as ischemia. One of the problem with heart failure patient also is impact heat regulation. So it is likely due to endothelial dysfunction and decreased reaction to nitric oxide. So this will result in uneven heat distribution in the body with higher core temperature compared to the peripheral temperature. So it is advisable for heart failure patient to exercise in a climate controlled indoor facilities, while mild heart failure patient in NYHA class 1 and 2 may have more flexibility to exercise outdoor in hot ambient condition or engage in high intensity workout. Then we go for innovative exercise approach. So the first one is yoga. Patient can attend, based on study, patient attend a total of 16 supervised sessions during 8 to 10 week period. During each session, subject complete a 5-minute warm-up phase during breathing exercise, which another called pranayama, and then 40 minutes period of standing or seated yoga posture, asanas, and finally 15-minute relaxation phase. On completion of the first 4 class, patient were given a handout of 18 yoga postures taught during class, and by inducing relaxation, yoga effectively reduce the activity of the sympathetic nervous system and inflammatory markers. And heart failure patients who engage in yoga twice weekly have shown improvement in peak oxygen consumption, exercise capacity, and also flexibility. Next is Tai Chi. Although Tai Chi is low intensity activity, it offers similar benefits to the low intensity aerobic exercise, such as improved neuromuscular function, aerobic capacity, depression scores, coordination, fine motor movement, limb muscle strength, especially in the leg and muscle grip, hand grip, and also circulation. Compared to aerobic exercise, Tai Chi poses fewer cardiovascular risks and is considered safer, making it suitable for individuals with arthritis and also the elderly. Next is aquatic exercise. Is conducted 3 times weekly over 8 weeks with session lasting 45 minutes, and this form of exercise has been shown to improve peak oxygen consumption, cardiac function, peripheral vasodilation, neural adaptation, muscle strength, endurance, ultimately improving prognosis and survival rates in chronic heart failure patients. Isokinetic movement are performed throughout the aquatic exercise session. As for conclusion, exercise training plays a crucial role in improving the well-being and also prognosis of chronic heart failure patients. Personalized exercise regime that take into account individual baseline health status, severity of heart failure, and also comfort level are essential. It is important to ensure that the exercise program produces an anti-inflammatory effects, as this can produce significant benefits. So by promoting physical activity and regular exercise, individual can contribute to the higher survival rates and better outcome for these patients. Keep encouraging and supporting them on their fitness journey. Thank you.